Okay, guys, we'll go ahead and call the meeting in order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Technical difficulties, bear with us. We have IT on it. You can use the video to do the minutes and then just have it fixed by executive session.
It's in there.
Yeah.
Okay.
You get it to it, and we'll look at it in executive session and tweak it.
Okay.
Wait
1 second. Okay, go.
All right. Item 3 on the agenda, roll call.
Dr. Sepulveda?
Present.
Mr. Stansberry?
Present.
Kendra Thomas?
Present.
Donald Stevens? Angelina Burkhardt?
Present.
Jackie Sheremy?
Present.
William McCarty?
Present.
All right, moving on. Item 4 on the agenda, approval of the minutes from the meeting from March 15th, 2023.
I'll make a motion to approve the minutes for March 15th, 2023.
I second.
Any discussion? All in favor?
Aye.
Any opposed? Motion carries. Moving on to item 5 on the agenda, financial report.
The financial report for the month ending February 28, 2023. Our total current assets are $1,503,713.33. Our total restricted assets are $710,991.45. Having our total assets at $2,214,704.78. We have no current total liabilities, so our net position, the same as stated before.
I'll make a motion to accept the financial report.
I second it.
Any discussion? All in favor?
Aye.
Any opposed? Motion carries. Moving on to item 6 on the agenda, the first public comment section, general comment as well as Morgan City High School's funding request to follow. And Sam, I'd like to invite Sam up to say a few words.
Quick comments. As many of you know, I worked for the governor and had a conversation about this circumstance, and we're here to help. I want to reiterate that from the last meeting. But before I get into that for 1 minute, we're going to overlay and reconstruct Highway 70 from the bridge to Marguerite Street. It's about $4 million. That's going to happen in the coming year. We're going to also overlay the rest of the highway out here all the way through to the overpass and beyond that. And of course, the longest living project that I've been working on was to reconstitute the old bridge, as they call it, the old bridge. That's going to start at the end of this month, or early next month. And then we will have done the bridge, both bridges, the roads, particularly the roads that are state roads that are going through the city. On the hospital thing, I have some idea of what you're going to propose in the future, and I just want you to know there are some dollars that are available to fill in the blank from when maybe there'll be money coming in, maybe, however that goes with the people. But other than that, I'm just here for support.
Thank you, and we appreciate your support. Administrator Mendel, thank you so much.
Thank you very much.
Thank you, Sal.
And this will be, again, a period just moving on for general comment, and we will have a second comment period as it relates to the OB unit further down the agenda. So we can jump forward to discussion on Morgan City High School's funding request. So we'll invite, come on up. Looking forward to the presentation.
Good evening. My name is Anna Aloisio, together with one of my coworkers, Sheila Fontenot, Gracie Gagliano, one of our students at Morgan City High School who is involved in our Allied Health Department, and our principal, Tim Hemhill. We come tonight to request a proposal of funds to help our Allied Health Department grow so we can produce better, productive members of our community and hopefully have them come back and serve our community. In December this past year, Sheila and I had met with a few of the board members in a private little meeting at the high school, and we discussed some of the funding and some of the equipment that we were, looking at purchasing. And we were told to make a wish list as if it was something we thought could really expand our program. So we came up with a wish list, and I'm going to show you in a PowerPoint presentation. It will break down exactly what the equipment is, how much it costs, and give you an overall of what program it will benefit with our different courses that we teach. Between me and Sheila, we have over 50 years of nursing experience together, and we bring a lot of real-world experience to these students with stories, situations that we've been in our nursing experience. We also were told to include our JROTC program and our school nurse. Our JROTC program is managed by Colonel Williams. He as well is a registered nurse, and he did combat nursing and Desert Storm trauma nursing. So he also trains his cadets in the JROTC program at our high school. CPR, stop the bleed, a lot of helpful medical procedures that could benefit our community. So we were asked to have him put a list of things that he would like to help with his program as well. With our Allied Health Department, we have 7 courses that me and Sheila teach interchangeably. We have a medical terminology course that we started this year. Allied Health 1, which is the introduction into the healthcare world. We have Allied Health 2, which is anatomy and physiology, where we go over all the body systems, normal and abnormal. We have a psychology department where we talk about behavior, normal growth, and abnormal behavior. We have a child development class where we talk about pregnancy, the newborn infant, how to care for the newborn infant. We started an EKG 1 class this year as a pilot to introduce the students into reading electrocardiograms. And we also have our the highest level class that we teach is our emergency medical responder class, where these students in high school are licensed as emergency medical responders when they leave Morgan City High School. Our courses serve approximately about 150 students a year between me and Sheila, and then with the JROTC program, Colonel Williams and Sergeant Stubbs puts about 150 kids through their program as well. So we're topping about 300 kids that are getting shown CPR, stop the bleed, some medical, skills that they can use out in the community. A lot of our program has flourished over the last few years, and we have a lot of members, alum from Morgan City High School that walk the halls at Ochsner St. Mary. A lot of them have come from our program. So what we're requesting is some, of course, most of you know medical equipment is very expensive, and we have to stay industry based and up to date with our equipment in order to meet the guidelines to teach some of these classes that we have. So we are requesting some funding to enhance our program. We have 4 specific programs within our Allied Health Department that I would like to touch on. And like I said, we included the JROTC and our school nurse because she is in need of some equipment as well that would benefit our students. So with our EMR program, this is our certification course that juniors and seniors take. It is guided by the Louisiana Bureau of EMS. They give us what topics to teach. They tell us what skills we have to teach that the students have to return demonstrate. And if the students fulfill the requirements of this course, they get licensure as an emergency medical responder in high school. Our equipment has to be industry-based, especially for CPR and just the skills that we provide for them to learn. What we're asking for is some additional Prestan child and infant mannequins, as well as some Prestan jaw thrust mannequins, because if there's a head or spinal cord injury, you can't do the head tilt chin lift like they teach you in CPR. You have to do the jaw thrust. And we don't have really any mannequins to simulate that for the kids. You know, we show them a video, but for them to, they're hands-on, they like to touch. So for them to physically touch and maneuver that jaw the way it needs to be maneuvered in that situation would really benefit the kids. So for our EMR department, we're asking for a 4-pack of the Pristine Jaw Thrust mannequins, and I broke it down by how much each thing cost. We're asking for some more trainer mannequins that have 4 bodies, torsos. When the kids do the CPR on the mannequins, it calculates the heart rate as to how fast they're supposed to do the chest compressions. So it gives them real world how fast they have to go. And it gives them a green light if they're doing it right, and it gives them a yellow or red light if they're doing it wrong. So they get real world experience of compression, and it goes the depth that they're supposed to compress as well. We also would like some Stop the Bleed training kits. This is something that we don't have, and the Louisiana Department of Education is kind of pushing us to try to teach this in case of any mass casualty event or anything like that that should happen. We do have 1 suction container that we've been using for years, and it has cracked over the years just due to being old. So we're requesting some new suction equipment, because in one of the skills we do have to teach them how to suction the airway out as part of one of the skills that they have to pass. We also would like some airway management trainers, because they do have to put in an oral pharyngeal airway and a nasal pharyngeal airway. That is part of a skill that they have to check on to get licensure. We're also requesting some naloxone nasal trainer sprays and the injector. That is a big push with the EMS Bureau to teach these kids about opioid addiction and how to administer naloxone in a manner that is appropriate to save someone's life if it should be an opioid problem. So that's with the EMR. Our child development class, this is a class where the students come in and they learn about pregnancy, they learn about the development of the fetus, they learn about how to take care of a newborn infant, and we kind of brought a simulation. This infant is all this infant carrier is computerized. We have a computerized program. We send the kids home with this infant, the carrier, the clothes, everything has a computer chip in it. So we can program it to cry at a certain time. We can program it to cry every 2 hours. We can see how long the student left it in the carrier without picking it up. We can see if it has been abused, like shaken baby syndrome. It will let us know that, and it'll cut the infant off. So it actually grades the student while they have the infant. And believe me, when the day they gotta come bring it back, they knocking on her door, please take this baby, please take this baby. They don't want to have it anymore.
At first they wanted it for a whole week, you know. It's like, wait, take it for
Yeah.
one night first.
Yeah, and they knock and come give it back. So some of the equipment, we only have 5 babies present, and she has 2 classes, and each class has 30 kids in it. So it takes us almost a month for every kid to take this baby home. So we're asking for some more supplies to get more babies so we can facilitate the process of taking care of the baby a whole lot quicker, so we can move on to other topics and not drag it out. Our EKG and medical terminology department was kind of sprung on us at the last minute this past year. We found out, I believe, in July that we were teaching it in August, like August 2nd. So we are requesting some funds for the books that we use. Me and Sheila had to purchase our own teacher manual to be able to teach these kids this. So the students actually don't have any resources. They don't have a textbook to take home and look at and do the exercises that we're asking them to do. So we're asking for some funding for some textbooks. And with our JRTC program, not only do they service Morgan City High School, he also has students coming from Berwick, Patterson, Centerville. So it's not just Morgan City High kids that get, some benefit from our program as well. It is some of the kids over the bridge. He is asking for some spine boards because he does some trauma-based moves with them on how to put a patient onto the spine board, get them moved out of the area. He does CPR. He's looking for some other things, some cervical collars, pre-hospital trauma bags, just to help enhance our program, get these kids with some more medical training prior to going out into the real world after graduation. And then our little school nurse, not last, because she has a very important job as well. She does a lot at our school, not only takes care of our sick kids, but she also educates the kids and counsels the kids. And one thing that she truly wants is a Dynamap. She's having to take this big basket of a blood pressure cuff and a thermometer and all kind of equipment when she has to go see a kid. Whereas if she has this little Dynamap, she can roll it, it's all in one. She can take care of the kid, do what she needs to do, and, move on from there. And that was her only request. So in total, and I know this is our wish list, we were asked to put a wish list together. This is what we're requesting funds for. I broke it down for each program, and in the PowerPoint that you all have, it shows you exactly what is being asked for. We are asking for approximately $50,000 to cover for shipping and handling and taxes, and anything on behalf of us, we'd like to thank you for having us, listening to us, and any assistance would be greatly appreciated. Thank you.
Well done.
Can I see the baby?
Yes, you sure can.
And
When you feed the baby, it actually makes little sounds like it's feeding. And then, there you go. It'll also coo, it'll burp,
Drop it.
and of course it cries. And if you do not respond very quickly, it'll start crying louder and louder and louder. And like she said earlier, if the student just takes it home and puts the baby down, the computer chip will actually read that it's abuse. And we do, I also teach the shaken baby syndrome within the program too, so.
That's what you need, Bill.
It's happening.
Full. No vacancy.
And they have a diaper, they need to change the diaper, there's a computer chip in the diaper, so it tells us if they really did change it to another one. They have to go home with 2 diapers, so they have to change it. They have to change their clothes. The computer makes sure that the baby's not cold. It actually does a temperature setting with it also. So it's really interesting to see all of the information that we get from the computer also. So the kids, I think, really do learn a lot from this program.
That's amazing.
I have a question. Is this program only at Morgan City Senior High, or is it throughout the parish?
Actually, it is throughout the parish. They do have a couple, well, in a couple of schools, I think they do have it. Patterson, I don't know.
I don't know, Patterson, possibly Berwick, maybe Centerville.
They had them, and then I know some of the health art classes at some of the other schools had kind of dwindled down a little bit. But I could find that out for you if you need to know how many throughout the parish that we have actively doing the program right now.
It just depends, because the
There she
programs
is.
are all
She knows.
family and consumer science. And it is.
Stand up and tell us who you
Oh,
are.
I'm sorry. I'm Miss Duval.
I know who you are.
She'll come with the building. But they do offer it in different programs. Each school offers it depending on what resources they have, either through family and consumer science or through the allied health program. And then if they don't have it, then they're able to take the course from another school.
Okay.
So they're able to participate across the district, and I know I see some of my counterparts are going to talk afterwards, but we'll be partnershiping some programs with Oshner, St. Mary, and also with the community providers, where they're going to bring back Safe Sitter and do some other things with the way we used to do career and career exploration. So we're rebuilding partnerships, but I will get with our CTE supervisor, and I can send you that information as to where exactly they're offering and through what program.
Okay, thank you.
And I had a question sort of very similar to what Kendra was asking, just regarding the other schools and whether or not they have access to the programs. If they do participate in the program, how possible is it to share equipment? If we were able to, I don't know if the education is all running concurrently, or is it possible to stagger lessons and share?
We actually share.
You do share. I know you mentioned JROTC does,
We
but I
share
wasn't sure.
within the school, and then we also share from school to school. For example, we have the Lamaze baby and the empathy belly. So each department can share it along the way, and then it kind of goes back into its home-based location.
Okay.
So as EMR changes its requirements, as family and development classes changes, we kind of coordinate that, and that's some of what I do with the programs as well as with the CTE supervisor. So we do share, or we guest host. The other school can come to us. We arrange with the school for bus transportation. We make sure that we coordinate the events or services, or we check with administration to see how we can do that. We also at several different times have worked with SLCC as well. So like when they offer their summer camps or different things, we're trying to bring under with Ms. Navarro, kind of bring that community resource the way you've brought in the community lab. We want to bring in all of the community. And by doing that, if we coordinate our efforts, it's not like a one-time buy and I put it on the shelf. We can use with JROTC the disaster preparedness. Some of his people could be the victims, so they could bleed out for a little while the other people tend to, and vice versa. So we do incident command. We work with the Office of Public Health, and we're going to start bringing in those things again as we once did. But when we were under different guidances, those things kind of fell to the wayside. So we do share and share alike, and then push came to shove, we needed something else, we'll see where we can pull those other resources. But like, for example, the Stop the Bleed, we're also in a partnership with the Sheriff's Department. So we're bringing in some grant stuff, but we're gonna be bringing in EMR, bringing in the community, and then bringing in so that we have ordered some trainers. And so all of that will be shared amongst the program. 6 trainers will do me no good if you don't know how to do the skill. So in preparation, some things get as what they call consumable, and so you have to sometimes replace that. But for the most part, at least since I've been here since 1994, we share and share alike. Even we cross bridges, waterways. I've been to Avoca Island to teach CPR, so I will go anywhere to help my community. So if you want more, like, we'd like to be able to implement some things and then bring you in so you can see what your money paid for.
So this kind of potential investment would benefit schools across our district?
Schools across the district, as well as programs in the community. Active shooter, all these things are a real live experience now. There are training programs for that. So as we build our workforce, we're building our community. And then we want a partnership with the people who are already there, and then bring all of that together so that when we put our head on the pillow, we've done our best.
Okay.
And I would add that Officer St. Mary reached out and said that they would check pricing on this just to see if they could use their group purchasing, firepower to get better pricing. As of today, we don't have that info yet, so I would just recommend that it would, the approval would be conditional upon.
And that would have been my other thing.
Yep.
You have bigger buying power than maybe I do, or you have resources that, especially if you even had something in the wings. Sue and I used to share mannequins all the time. We just did what needed to be done and made sure we followed the rules and put it back clean like we back. Okay. Jackie was my HR director.
Thank you.
Thank you.
Move on to item 7 on the agenda. That's what we want now.
So just ask for the promotion to recommend it.
Yeah, so, any more questions, everybody? Questions? Phenomenal program. Thank you for sharing. So I'm looking for a motion on this request made by Morgan City High School Allied Health Program and a potential entry into legally appropriate CEA endeavor with St. Mary Parish School Board for any further contributions.
Make the motion to fully fund their request and for you to enter into a CEA with the St. Mary Parish School Board.
We're going to say anything about the optionals amendment?
Well, it would be conditional on that.
We have to say it?
We can say, with appropriate legal entities, all the parties that desire to participate in it.
That's fine. Okay.
I second.
Any discussion? All in favor?
Aye.
Any opposed? Wishes granted. Keep up the good work, guys. That's amazing. All right, moving on to item 8 of the agenda. We're going to step aside for a brief executive session to discuss some strategic planning. Yeah, it shouldn't be very long, guys. So I need a motion.
I make a motion that we go into executive session.
I second.
All in favor?
Aye.
Any opposed? All right, motion carries. Did it work?
So the Board of Commissioners, they are currently stepping into an executive session. We will come back live right here on the KQKI Digital Video Network when they come back from that executive session. I'm Brady Borrell for 95.3 FM